Hey guys, it's coronavirus day 429. Stay at home day 38. And so, as a note, due to some risks and a possible wave 4, please do not have any gatherings, especially during Victoria Day. Who knows who might get affected next? It could be someone who you care about, like maybe a family member or a friend or relative or someone in the community you know. We have to just make sure, like, we don't, as Peter Juni said, and he's a doctor. So he's not one of those politicians who don't really care about what the doctors and scientists say. So yeah, he has warned that we can't afford to make the same mistakes as last time. So, because wave 4 is going to come, it might, if we don't have, make sure we don't screw it up. Because in the fall, there's going to be 3 problems if we're going to have to deal with that. And it's the common cold, the flu, and coronavirus. So, of course, coronavirus cases. So coronavirus cases are higher today. So it's at 2,584 coronavirus cases. So so Toronto and Peel region are still in the high with 689 high cases from Toronto, 584 high cases from Peel region, 252 from York region, 157 from Durham region, and 115 from Hamilton. So 24 deaths have been reported today. And of course, variant cases, of course, yes. So variant cases, unfortunately, are have increased to a dangerous 106,043 UK variants, making this our biggest threat and also the new highest. And of course, it's always going to be the first. It's the first variant that hit. It has increased by 2,179, 625 South African variants, which is an increase of 31. 1,853 Brazilian variants, which is an increase of 107. And I don't know about the Indian double-mutant variant, but since it's not a variant of concern, of course, Health Canada is doing and WHO is doing a lousy job. Though with the cases were last time at if you added up Brampton's double India double mutant cases, variant cases, and Ottawa's much higher India double mutant variant cases. It added up to 177. So 36 from Brampton, 141 from Ottawa, and also two deaths from Ottawa. And however, 2 out of the 3 people from Ottawa were following the rules, and there was a third person who did not follow the rules, and this person, he or she, made their way to the GTHA, so somewhere in the Greater Toronto Hamilton area. So who knows where that person end up? Who knows? And so India's cases, coronavirus cases have gone down, and which brings me what I want to talk about. But of course, vaccination details. So if you want to go get vaccinated, like sign up, register for vaccinations, you can book online through at covid19.ontario.ca/books-vaccine by phone. The toll-free number 1-888-999-6488. I've checked the government website, and yes, that is the correct number. So at a pharmacy, so which you will have to wait a bit longer compared to the regular booking. And the currently the Pfizer BioNTech vaccine and Moderna vaccine is going to be in use because the AstraZeneca vaccine, there was a lack of supply and also some safety concerns. So vaccine bookings are available for children 12 years of age to 17 years of age through that age group, starting May 31st with the Pfizer BioNTech vaccine, and also through a special dedicated youth and family clinics throughout June 14th, the week of June 14 and June 3rd, 21. And stay-at-home rules are down below until June 2nd. And what I wanted to talk about. So Doug Ford had requested to send ventilators to India to help out India's people in India affected with corona. So a report came from India saying the ventilators made it there. So Doug Ford did this in a sort of in a way to support people in India. So India had received 500 made in Canada ventilators from Ontario as uh, during their devastating second wave of the coronavirus pandemic. So on. So a tweet was uploaded on Twitter by Arindam Bagchi, the spokesperson for India's Ministry of External Affairs, and so he said India received 500 ventilators, and is grateful for the provincial government of Ontario, Canada, for this generous donation. And then there was a couple of photos. And there was a photo of the Canadian flag, the Ontario flag, and the India flag. And there was a whole bunch of boxes to Fly Emirates. So Ivana Yellen said that this shipment is the first tranche of the 3,000 made in Ontario ventilators that are landing in different parts of India for the next few days. And of course, Doug Ford mentioned it last month, and finally it made it. The ventilators made their way into India successfully and no problems. So I think it was like some people were still concerned about why aren't you opening the province, but think about it please think about it this way, because over the years there have been disasters that had in countries all across the world, from tsunamis to earthquakes to and of course those people in those countries that they needed help, and of course the Red Cross was helping, and so a lot of people donated money to help these people in these countries. So this is Ontario's way of helping the people who are affected by the coronavirus in India by sending ventilators when they needed help the most. And then when this was happening, India was contributing almost up to 50% of all coronavirus cases worldwide. So this is not something we're not unfamiliar with. People have done this kind of generous thing before. And the High Commissioner to India, Nader Patel, he welcomed the first consignment of what he described in a tweet as urgently needed medical supplies. So including 25,000 vials of antiviral COVID-19 medication, remdesivir, and 50 ventilators. So what is making literally what was making the cases worse for India was not just the coronavirus cases, but you know how I meant, you know, the Indian double mutant variants, which is more yeah. Which yeah, that's the variant, that very variant that Health Canada is saying that, oh, it's not that serious, and of course it's not a variant of concern, it's a variant of interest, you know, like this. But in India had had the shortage of oxygen because of this, and yeah. I hope the ventilators sent over, and more to come to India eventually in the next coming weeks or months. I hope the ventilators do help out, and hopefully other countries are also pitching in to help. And there's a new update, so there's the flight ban update from direct flights from India and Pakistan have been blocked from banned from any flights from India or Pakistan until June 22nd. I'm being told by Air Canada. Well, only Air Canada is doing it so far. The federal government has not announced it officially yet. So, and of course, I'm gonna just do a reminder of the EMCPA rule. So for the fine is regular fine is $750 in fines, and depends. There might be a $150 fine. Portal Police did that to people fishing in our area. $880 to ride check if people are violating that. You know, if you're not traveling for essential reasons with other people, and yeah, this was yeah, some people from Brampton, they got caught by Timmins police, and yeah, all the 5 people in that vehicle had to pay $880 each. And ride checks are legal, 100% legal. So $1,000 for anyone who's trying to prevent anyone from following coronavirus regulations or lockdown regulations or rules or stay-at-home orders. So yeah. $10,000 for those who have planned the organizer planned the gathering, and if it gets severe, $1 million in or maybe even jail time. So, hospitalizations. Okay, so hospitalizations is 1546. So it's sort of lower than yesterday's. Okay, good. Minus 36. 785 ICU patients. Plus 8. Yeah, I feel bad for the critical care nurses. Ouch. 560 ICU patients using a ventilator. That number has not changed. And I'm not seeing the long-term care homes numbers or the outbreaks though. So the last time it was 2,765. That was yesterday's number. And staff deaths were at 13 starting yesterday. And outbreaks we left off at 36. So please follow coronavirus safety rules and regulations and stay at home rules. Please do not have any gatherings, especially on Victoria Day. Please do not ruin it for the rest of us. If you want coronavirus cases to go down, and wave 4 to not come, by wave 4, you gotta cooperate, and let's stay. So please stay safe.